Think we're live.
Hello, it's Robin and Kim here today. And on this Wellness Wednesday, I'm not very well, so excuse the way I'm talking through my nose. This bronchitis is kicking my butt. Maybe we should do like cold and flu, summer cold and flu prevention or something, because I don't know how I got this. But anyway, what we're really talking about today is Cataract Awareness Month, because the month of June is all about cataracts. And I'll tell you why. Um, the goal of this being Cataract Awareness Month is we want to educate the public about cataracts, their impact, and the available resources out there. Cataracts are a leading cause of vision loss and blindness worldwide, which I did not realize that. And raising awareness helps individuals understand risk factors, symptoms, and treatment options, including cataract surgery. So I didn't realize it too, because I thought to myself when we were going to do this, like, does everyone eventually have to get cataract surgery? And from what I've read, it says no, not everyone does, but 80% of the population does. So that's a huge number there, a percentage that do have to get it done. Um, Talks about also, let me think about what else I wanted to tell you. Oh, it's, if you don't know what cataracts is, it's a clouding of the eye lens that you has, and it causes that blurriness or vision loss. Things that can make it worse or make you have it is not wearing sunglasses. So UV protection is very, I can't even speak because I don't feel right, but it's important. There you go. So wear those sunglasses and all the time when the sun's out. I don't understand how people don't wear sunglasses. I have them on, even if it's like slightly cloudy, I have mine on. Um, so also, I read too where it said like stay away from unhealthy fats. So not eating, crappy fat. Eat healthy
Yeah.
fat, but not crappy fat. And then the things that you want to do to get in your diet are lutein, zeaxanthin, and beta carotene. And definitely the lutein was the most important because that is actually in your eye lens anyway, lutein. So you want to give more of that in there. And so that's what I kind of wanted to tell you a little bit about what it is and why we should be thinking about it and making awareness about it. And then Kim is going to tell us more about it because she just had cataract surgery, what, 2 weeks ago, right?
Yes. Yep.
Yeah,
Yeah, I did.
you did that. It's so funny because when I went and had my LASIK tweaked, he said, "Well, you'll be back in here in a couple years to have your cataracts, probably." And I'm like, "What?"
What? Yeah.
I thought
Well,
only old people got that done.
hello. That's what I said. That's what I said. When he told me, he said, you're a candidate for cataract surgery. I'm like, that's what old people get, not me. Anyway, he said, actually, all people, all ages have had cataract surgery. So I learned a little bit more about it and how um, what brought it up to my doctor was that, like, I noticed last fall when we were like at our Bengals football games, I couldn't see, even with my glasses, like the players weren't crisp, things weren't crisp far away.
Mm-hmm.
And then also we go to the theater a lot and looking at the stage, like things weren't crisp anymore. And I'm like, oh, what's
Right.
going on? My glasses aren't working right. And so, and then he said, well, your cataracts have gotten worse. So basically what it is, they remove that lens and replace it with a lens that will see far. And so that's what I did a couple weeks ago. It was very painless. They do put you under, you barely, it's a twilight. I don't remember much about it. I do remember and then the doctor came in. I think it's like a 10-minute procedure.
Mm-hmm.
And then you just lay low the rest of the day. And the next day I was driving. That's
That's awesome.
that's how quickly you can recover. And so it really is minimally invasive and minimally intrusive in your life. So anyway, I
So
had one.
I have a question though.
Yeah.
So like my mom had it done, so she has really bad sensitivity to light now,
Oh,
and she had to go back in and they had to like fix up some things and do whatever to try to make it better or whatever. So I want to know, did you have any side effects or anything, or have you noticed any?
yeah. I noticed things were brighter on my left side. And
Mm,
then I know, and my eye was very dilated the first day. And then I was seeing like a little flashing, like, a light was flickering or something. That's gone away. That was for
Good.
the first 2 days, I think. And then, but I can tell when I cover this eye, I can see far out of this eye. When I cover this one, it's still blurry. Or when yeah. So this is, so anyway, it's
That's the
like,
way
oh,
they, yeah.
it really works. So anyway, I'm having the next one done in a couple weeks, but anyway,
So then
so
you'll be able to see totally far away, and then you'll have to
yes.
wear readers probably.
2020 vision. Now, what I'm going to do is and I wish I had done this with the first eye. I wish I would have gotten, you got to pay extra for this. I wish I would have gotten the close lens too put in. And I have an astigmatism on the side, not to get so detailed, but
Well,
I
that's
have to
okay.
have the next level up anyway on the side. But now I'm asking the doctor on Friday if he can still put the full one in this eye. Because I know people wear one contact, some people wear a contact, no contact, or I have a friend who had cataract surgery. She's got the full one in one eye and then the regular in the other eye. So I thought, oh, I'm going to see if my doctor will do that. So, but if not, I will have to wear readers and I can tell my close vision has gotten worse.
Yeah,
So
yeah,
that's kind of a
yeah.
bummer. But anyway,
Well,
but
yep.
but it's nice to see far.
And
I
you're
like,
not going to go blind, so that is a plus. Yeah,
yes. Yeah,
for
yeah, yeah.
sure, for sure.
So anyway, yeah. So I think, now that I've been through it and kind of see what it's about, I realize it's not a, not a big deal and it's not scary and it's just another way to take care of your eyes and your vision. So yeah,
Good.
that's it. Do you have any other
Well,
questions?
it's no, I think that was all my questions, ma'am.
Okay.
But it's good to bring up these things because I think like us, when they said that to us, we're like, what? Wait, what? I'm supposed to have this already? That's something that we think comes down the line, but it's really not. I mean, it can be, 65, 66,
Younger.
67. Right,
Yeah.
right. So take care of your eyes. Um, wear those sunglasses. Try to stay out of the sun,
Oh,
for
let me
sure.
say one thing about that.
Yeah.
I do try to get morning sun on my eyes because it helps with sleep later that night. So that's part of my sleep routine is to get light on my eyeballs in the morning. But yes, I agree. Then wear the sunglasses.
Yeah,
But
for sure.
yeah,
Don't look
so
into the sun though.
right, 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 right,
All
right,
right.
right. Yeah. All right. Well, I think that's it.
Yep. That's all we got this week.
Thanks for joining
So,
us. And as always, have fun and live young, and we'll see you next week.
yep. Bye bye.